So, which of the following mechanisms is the most likely contributing to the patient's chest pain? So, a 70-year-old woman with a past medical history of hyperlipidemia and osteoarthritis presents to her primary care physician for a routine checkup. She reports occasional chest pain upon exertion, which is relieved by rest. On physical examination, the physician notes a systolic ejection murmur at the second intercostal space, which radiates to the carotid arteries. The patient's blood pressure is 40/80, and her pulse is regular at 68 beats per minute. So the ECG also reveals a left ventricular hypertrophy. Okay, all of this makes sense because what I'm thinking that it's a left-sided heart failure. And it makes sense because it like kind of backs up into the system, and then we have that like hypertrophy. And then, so in patients like this, um, it wouldn't be decreased aortic compliance, the increased left ventricular and diastolic pressure, perhaps increased myocardial oxygen demand. I think it's increased myocardial oxygen demand.
Okay,
So,
final answer.
yeah.
Yeah, and a lot of heart pain is going to be caused by increased, right, or angina, right?
Mhm.
Um, but patient presentation, chest pain, right, on exertion relieved by rest, systolic ejection murmur, right intercostal space, right. So this is usually aortic stenosis. That's going to be your diagnosis.
Okay.
Okay. So remember, aortic stenosis increases afterload of the left ventricle, right, which causes left ventricular hypertrophy, and then increased myocardic oxygen demand, which causes angina, right, during exertion. So, but decreased aortic compliance refers to reduced ability for aortic to expand and contract, with change in blood pressure, which can cause increased amount of systolic blood pressure, but it's not the aortic stenosis in particular, right? This is increased left ventricular end diastolic pressure, which is left ventricular cannot adequately fill, which is not kind of what's causing your angina here. Increased systemic vascular resistance, that's like increased blood pressure here. Reduced coronary artery perfusion can cause chest pain. However, this patient has aortic stenosis, so that's because the increased amount of oxygen that the heart needs because it's larger and the increased afterload. So best answer, like you said, is increased myocardial oxygen demand.